Okay, I am Rachel, and I'm here at our Natural Wellness Forum. It is Wednesday night, and I'm here every Wednesday night. I'm so glad you guys are here today because I'm so excited. Today I have a live doctor, and he's my brother. You know, they're all my brothers and sisters. Dr. Martin Ruiz. And Martin, where do you live? I know you're in Texas.
Right now, I'm living in Weatherford, Texas.
Weatherford.
Yes,
You're
but
moving to
hopefully, we'll be moving to Justin. And
Justin.
I work in Decatur, which is about half an hour north from here.
Okay. Okay. So today we have a very common topic. Okay. So this is something that, I mean, everybody knows somebody with diabetes or prediabetes. And it's very important. It's a very important subject because it's just blooming. Like, I mean, it's when I was in school, many decades ago, like there may have been one other student in the school who would have to go to the nurse to get their insulin or whatever they need to get. Now it's like they're sending children all the time to the nurse. You know, it's like juvenile diabetes is just like it's exploded, right? So there's something that we're not doing, and this is what we want to touch on today. So let's get this started. I went directly to the CDC website because I want to break it down exactly what is diabetes. And I'm gonna try to simplify. I'm gonna read what they're saying, but I'm gonna try to interpret it from how I see it, which is from a very simplistic perspective. But so it says on the CDC website that diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. Most of the food you eat is broken down into sugar, also called glucose, and we'll get into that later, and released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. And insulin acts like a key to let the blood sugar into your body cells. And our cells do need this glucose, this insulin. So if you have diabetes, what that means is your body either doesn't make enough insulin or can't use the insulin it makes as well as it should. Okay, so when there isn't enough insulin in our cells, or our cells stop responding to insulin, too much blood sugar stays in your bloodstream. And over time, that can cause serious health problems. And we know people who have gotten to that stage. So before we go into more detail, Dr. Ruiz Martin, tell us a little bit about yourself.
Yes, Rachel. Thank you so much for having me here today. I'm originally from Peru. I've been here in the United States for about 27 years. And actually 37 years, sorry, not 27 years. And I lived in New Mexico for the last 14 years until up until probably December of last year when I moved here to northern Texas. I'm working currently at Decatur at the Wise Health Centers in Decatur, Texas. And like I said, I live in Weatherford, and I went to school in Mexico, the University of Guadalajara in Jalisco. And then I did my pre-training in New York. And then I flew to Puerto Rico, actually, to do my residency and my diabetes training as well. And I am an internal medicine physician with the background of diabetes management and metabolic syndrome. And so I deal basically with a lot of diabetes, obesity, and high blood pressure, cholesterol disease, and anything actually that will cause or decrease the living of the health of the patients. Yes. So I've been doing this for many, many years, and I love it. I mean, I'm very passionate about the management of diabetes.
Yes, that's why we have you on the show today.
Thank you. Thank you very much.
Thanks so much for being here. So we do know that there's, we have type 1 diabetes, type 2, and then we also have gestational diabetes, and then pre-diabetes. Can you go into a little detail about that?
Sure. The recent data is amazing because, I mean, we've known for many, many years that anybody could just give a very wild guess about what the population of diabetics would be in any country. And it has come true here in the United States. I mean, you can say basically 10% of our population nowadays is probably true diabetics. Within that 10%, there's probably some percentage missing because people have not been evaluated, people have not been counted. But the other thing is that 90% to 95% of those that are considered diabetics are type 2 diabetics. You know, as a very modest percentage that we have that are type 1 diabetics. The cases are rising. We don't know why. I mean, I've been seeing in the last probably 10 years an increase in type 1 diabetes, which is in essence insulin dependent. Why? Because type 1 diabetes is an autoimmune disease. There's a subtype of type 1 diabetes that occurs in older adults as well. It used to be within the middle, sort of about 30 to 40, 40 to 50 age. But in the last 10 years, once again, for whatever reason, we've seen an increase in patients of type 1 diabetes or later, we're talking latent adult onset of diabetes, an autoimmune disease, on patients that are in their 60s or 70s. And it is an autoimmune disease. So there's a subtype of type 1 diabetes also that occurs, you know, in the middle ages or later in life. Gestational diabetes is mainly focused on the aspect of diabetes associated to someone who is pregnant. And it's associated mainly to the hormones secreted by the placenta. There's insulin resistance, and that's why women tend to have diabetes, but also is associated with risk factors. You know, women that are overweight, women that perhaps were at the verge of diabetes or even had diabetes when prior to their pregnancy, sometimes can actually develop worsening of their condition when they're pregnant. So there's some factors that's around the aspect of gestational diabetes as well. And type 2, well, type 2 is associated to our lifestyle. It is genetic in one aspect, but we have the ingredients there that will be sort of showing up if we actually put ourselves in certain situations. You know, so if we gain weight, if we become very sedentary, if we don't eat properly, you know, if we have an exaggerated consumption of carbohydrates, all that stuff is going to add up to the aspect of the onset of diabetes type 2.
Let me ask you a question. So you said that type 1 is insulin dependent. Can you explain what insulin is for? Why does
insulin is insulin is a hormone that is secreted by your pancreas. In fact, it is a hormone that triggers multiple functions in the body. The main one, of course, is to grab glucose and transport it into the cells. One of the things is that a lot of that transport of glucose into the cells also occurs in the adipose tissue, the fat tissue. And so the higher the amount of carbohydrates we consume, the more triggering of the pancreas to secrete insulin. The more insulin there is, the more transport of carbohydrates or glucose into the adipose tissue, the fatter we get. That's how we gain weight. We gain weight mainly because of the excessive amount of insulin circulating in the bloodstream. We call that hyperinsulinemia. It is an increased amount of insulin in our body. And so the patients that have type 1 diabetes, unfortunately, they do not produce any insulin because their beta cells were somewhat attacked by their immune system, and they destroyed the beta cells that produce the insulin, and they no longer can make it. So they have to depend on the supplementation of insulin versus type 2 diabetes, which normally doesn't happen like that unless, you know, the disease is far advanced.
Gotcha. Before I ask you the next question, I just want to make sure you guys share this information, share it to your friends, share it to anyone who needs, that you know and love, that needs this information. And also let us know where you're watching from, because it's always good to know who's out there and who's watching. So Martin, one question about type 2 that kind of piqued in my head that I'm not sure about, because you started off by saying it's usually predispositions, usually a predisposition. So the first thing I think of, if I know my grandmother had it or my uncles had it, you know, I'm gonna probably be more susceptible to getting it depending on the choices that I make as far as my lifestyle. Like you said, sedentary, the dietary choices that I make. Can you expound on that just a little bit more? Sure.
I mean, there's a lot of ethnic groups in our world actually that are predisposed to the onset of diabetes. I mean, I am Latino. We are predisposed. Native Americans, predisposed. Islanders are predisposed. African Americans are predisposed. So there are certain group of people in the world that are predisposed to this. And the interesting thing is that, for instance, we've done studies where they have brought they followed groups that came from their country where they didn't have any diseases, right? They were in an environment where they ate more healthier, they walked more because they didn't have the availability of getting cars or transportation that was really easy, like being in New York and stuff like that. So they had to exercise, and those people were healthy while they lived in their country. For instance, India, Hindus, or people from Africa itself, and people from the islands in the Caribbean. If they move to the United States, we are loaded with a lot of bad choices in our food supply, and people tend to take a lot of transportation. People don't exercise anymore. They drive cars. They get into buses, and so they become more sedentary, and those will lead to, of course, overeating, weight gain, sedentarism, of course, lack of exercise. There's no muscle toning. Muscles get atrophy, and so those people start developing the actual disease. I mean, you go from pre-diabetes, then it progresses through many years to diabetes, and as an onset. But it is because you have changed your lifestyle. So most people could be predisposed, but it is what you do in your actual as you age also, because it's a lot easier for us adults to start becoming sicker when compared to children, where they have to actually be exposed to certain amounts of carbohydrates on a daily basis, like in school and stuff like that, to become obese and then, of course, diabetic. But for the most part, as adults, if we change our lifestyle and we have predispositions already because of our ethnicity, then we're going to develop the disease.
So you had told me a little bit about where you're from, and you had mentioned, I'm not sure if it's like a community, but they ate more, they raised their food and their own livestock, and they would eat not the same, but they would eat, pork and beef, and you want to tell the viewers a little bit about the difference with that.
Of course. So another views that some researchers have done is that, and I've actually seen it in my practice, is that people that have maintained a very natural way of living, meaning that they raise their own animals, they plant their own crops, and they have their own food sources within their homes, and they are well kept without being tainted with the genetic manipulations, or some sort of growth enhancement or even flavor enhancement that we do in our society. Those people tend to be a lot healthier in regards to metabolic disorders compared to the general population, because they are eating stuff that is completely natural. I mean, pork, for instance, I've had patients that have eaten a lot of pork and they don't have any problems with their cholesterol. They have eaten a lot of products like lard. In fact, some people use lard to fry things in the fields, and they have not had any problems with cholesterol or heart disease for that matter. The biggest populations where they are surviving longer in the world are the ones that are more rural. Peru and the Andes, people tend to live on average probably 90, 100 years old. If you think about Okinawa in Japan, is that island itself. I mean, it's just amazing the length of survival there. I mean, people average is 100 years.
Yeah.
Because they are surviving from natural sources. So natural food is very important. I mean, organic food has become expensive. It's expensive right now, but once again, I mean, if we are able to have somewhat of a choice to buy products and consume something that is healthier, organic is always the best way to go, because you're eating something natural. We have to understand that our food supply has been tainted and has been manipulated, has been overprocessed, and it's not natural food anymore.
Right, and I can actually see, the benefit of being in an urban area, more jobs, more resources, but also see the detriment of being in a rural area. But we still, like you said, I like what you said, we still have the choice, because in an urban area, we will be able to go and seek out, more natural foods, yes, it is more expensive, but what's the price of health? I mean,
Exactly. You have to think about your survival. You have to think about your health. I mean, people may complain right now because they're spending more money in regards to something that is a lot healthier. But you know what? Getting sick and paying for your medications is going to be 3 times more expensive.
exactly. In the long run, you're gonna end up paying for it, right?
Exactly, and a lot more. Trust me. I have this conversation. In fact, I had 2 new patients today. We have the same conversations where people surviving, especially the elderly, surviving out of Medicare, receiving probably about $1,200 a month. More than 60% of their check goes towards medication. I mean,
Wow.
that's not a way of living.
Yeah,
Honestly, that's not a way of living because every medication that they have is very expensive, and there is no need to do this when this disease can even be reversed.
exactly. So let's talk a little bit about the pre-diabetes, because that's the major component or the largest population of diabetic patients is, right.
Exactly. So 4 years ago, which is really interesting, I did a presentation with a bunch of colleagues at the University of Beijing in China, and one of the things that was surprising for the audience was that I mentioned that here in the United States we do not practice preventive medicine.
Mm.
This is just disease management. This is what basically we practice here in the United States, and prediabetes is actually preventable. Okay, just like it is diabetes. And if you want to prevent diabetes, you have to really catch patients when they are in maybe in the pre-diabetes stage. 95% of the patients probably over the age of 45 are pre-diabetics in one degree or another because of our poor diet.
Oh,
So it is very shocking, yes. And so nowadays, we doctors should at least check a patient once a year and check for their A1C, which is the marker for pre-diabetes and diabetes, to make sure, of course, assessing the risk factors, to make sure that those patients do not fall through the cracks and they end up having diabetes at one point. I've seen that in my years of as a practitioner. I've seen many patients that have fallen into the cracks and they have not been followed, and they end up coming to me to see me for diabetes, or I even diagnose diabetes, newly diagnosed diabetes. So the downside of this whole situation is.
Let me stop you there. Make sure you get tested for your A1C with your doctor when you go for your checkup. Okay, go ahead.
Yes, you have to at least once a year. And if there's abnormalities, of course, doctors have to actually do something about it, especially dietary changes have to be emphasized. But anyhow, prediabetes is a disease where you find what we call a lot of insulin resistance. When your body becomes more or less submerged in the exposure to carbohydrates in excess, especially excess, your body somehow is going to sort of alleviate that load by overproducing insulin. Mm-hmm. And so we know that people that have prediabetes, there's an early stage where they actually have what we call hyperinsulinemia. This is a term that I just said. Your body produces too much insulin in order to bring down the levels of sugar. I mean, if you eat 20 donuts in the morning because you love donuts, and your blood sugars go all the way to 300, but because you are not diabetic yet, your body is going to have the ability to bring it down. Your body is going to have to increase the output of insulin in order to bring that amount of sugar that was created from the donuts themselves, and it has to come down. The problem with that is that if you do this time after time, very often, it's going to come a point where your body is going to get exhausted, and you start losing the ability to produce, number one, the amount of insulin you're supposed to. Yes. Now, the little amount that you actually start producing, okay, is not going to be efficient in stimulating your cells and your body to uptake, to absorb the glucose that is in your blood. So that's basically insulin resistance. You lose the ability, your cells lose the ability to really respond to the stimulation of the insulin. Mm-hmm. And so that happens through many, many years. And it comes to a point in someone's life, in the being in the world of pre-diabetes, that they will lose the battle because your body will continue to get worse every year that passes by. That you don't, if you don't change your eating habits, your body will continue losing the ability to produce insulin little bit by little bit until it produces so little. Now your blood sugars are going to be rising more than they're supposed to, and then you become diabetic.
Right. And that's, I don't know why I always think of a car, like car maintenance. Like, if I don't get an oil change, eventually my engine's going to give out, right? So that's the first thing that pops in my head, right?
Of course.
So, I want one last thing I want to talk about on diabetes, and then we're going to move into talking about the simple ways that we can help. So I want you guys to hang in because he has some very simple, effective, easy ways to help with the prevention, right? And that's juvenile diabetes. I want to ask you about juvenile diabetes. Why is that increasing so much?
Well, because of our lifestyles again. I mean, you know, if people haven't really paid attention, and I have, of course, because we go out. I have my wife and my two sons, and the youngest is living with us. You know, as we have gone and buy stuff in the grocery stores, I've been noticing that things are getting very expensive. But simple stuff like simple carbohydrates, you know, crackers, cereals, juices, sodas, all those things are always on sale, very cheap.
Yes.
You know, so the economy in this country is not doing well, and it's not been doing well for a long time, at least for the general population. And the thing is that this is actually causing a lot of people to be a little more simplistic. Some people may not be cooking. You know, they go and buy combos at the fast food restaurants because, you know, you with $5 you can get a lot of food probably, and $10 probably you can get a lot of food. So a lot of these kids are being fed stuff that is actually causing them to gain a lot of weight.
Yes.
And once again, you know, the aspect of your body trying to save you from the amount of carbohydrates that you're consuming plus the amount of insulin that your body has to make so your blood sugars don't increase very much is going to cause the weight gain, because a lot of insulin production is going to put all those carbohydrates into the fat cell, and kids are going to be chubby, and kids are going to be starting to gain weight. So, like I said, diabetes doesn't happen from one day to the next unless you have type 1 diabetes. Okay, I mean, and it takes a little while, in fact, for type 1 diabetes to become present. But type 2 diabetes, or young, you know, diabetes of the young right now is something that takes precedence for probably several months. You know, the problem is that you're talking about a small body compared to an adult. You're talking about a small body where the weight gain itself amplifies, and the destruction probably of the beta cells and the lack of insulin production is going to be also magnified compared to an adult.
Right.
And because of that, you see kids, you know, at 8 years of age, 10, 12, 15, having diabetes because they are morbidly obese. You're talking about morbid obesity at that age is going to be very, very detrimental, and is going to cause severe insulin resistance. And insulin resistance will lead actually to the onset of diabetes.
So you've mentioned obesity several times. What about thin people?
Well, thin people can also get, you know, this is so interesting, but I have not seen, of course, a kid to have diabetes being thin, unless, you know, we're talking about type 1 diabetes, but adults can have also diabetes being thin, or at least somewhat in shape. They don't have to be morbidly obese or even obese. They just have to be maybe a little bit overweight, perhaps more of the central obesity, as we call it, meaning that most of the adipose tissue is in the abdominal area. You know, some men might have a little bit of a belly, but they are not really thick. I mean, they're probably, you know, a few pounds above their ideal weight. But it all comes down to the fact that what is it that you're eating? Because if you are promoting visceral obesity, meaning that fat starts growing within your around your organs, that can also cause a lot of insulin resistance. And insulin resistance, like I said, is the foundation for the onset of diabetes, because you start losing the ability of handling sugars. You know, one of the things that I did in my research when I went to China was that the Chinese people is the number one country in the world with the highest incidence of diabetes. So
really?
Yes, 10%, 11% of the population are diabetic.
Really?
So yeah, China is number one, India number two, and guess who's number three?
What? Really? I love Indian food.
So the United States is number three. We are third in the world for the incidence of diabetes.
Really?
Yes.
Okay. Okay. So everything, all the information that he's given us so far, giving him a love and thumbs up. He's given us some great information. Now, this is where I like to sum up and come into coming into a place where you can take responsibility for your own health. So Martin's going to give us some practical, simple ways to help keep it under control. So I'm excited to hear that.
Sure. So for the last probably 5 years, there have been a lot of course, reviews on the multiple diets that we have available nowadays. I mean, it all started probably with Dr. Atkins, and then you have this beach diet and all kinds of other diets. The keto diet came out, and some group of people went and researched different types of diets, and I started noticing the benefits and the cons on each of them, and they found, of course, that the number one common denominator for all these diets is people they were not able to continue them for a long time. These were always short-lived. And the other common denominator was that all of them actually had a low carbohydrate consumption, low carbs in general, okay? Low carbs. And so if we are talking about individual sort of diets, carbohydrates, of course, are the number one reason why we have problems with diabetes. It is number one reason why probably we'll start gaining weight. One of the things that I heard from other colleagues that are very bright from the West Coast is that a carbohydrate is not really a carbohydrate. The same one carbohydrate is not the same as another carbohydrate. You cannot compare, 1 gram of carbohydrates coming from potatoes to 1 gram of carbohydrates coming from probably lettuce or coming from broccoli. They're not the same, because if we want to talk about simple carbohydrates, the potatoes will have more simple carbohydrates. Chances are it will stimulate your insulin to be over secreted, and because your blood sugars are going to rise faster. Okay, when you are consuming simpler carbohydrates, when you're consuming more complex, you're consuming carbohydrates that are coming more from a plant-based diet. It's going to be a lot easier to handle, a lot easier to burn, a lot easier to be utilized in the body as an energy source compared to the more simpler carbohydrates, coming from processed foods or even, starchy vegetables, because then your body will utilize some of those carbs, some of those glucose, and then it's gonna store the rest. So you have to be very careful. So one of the things that we've been doing in my clinic is that we have modified the ketogenic diet. The modification comes in many aspects. One of them is that we are not really as strict as the true keto diet in regards to the amount. I mean, we want patients to feel comfortable. I mean, we want patients to be able to sustain their proper eating. And our diet is also non-restrictive. We don't restrict anybody from eating something that they like. What we want is to make sure that the patients identify the true carbohydrates. The carbohydrates are simpler, and they eat them in portions. We want our patients to not eat more than 60 grams of carbohydrates in a given day. And we try to move those carbohydrates, the carbohydrate consumption, to the early part of the day. So we want the patients to actually eat the carbohydrates at breakfast and lunch, okay? And then at dinner, it has to be as clean as you can make it. I mean, you can eat simple carbohydrates, healthy carbohydrates from your vegetables, from the non-starchy group of vegetables, plus your lean proteins or your good fats, like avocados, nuts, olive oil, avocado oil and stuff like that. You can have that. But throughout the day, you can also have the same things. I mean, there's nothing wrong with you eating proteins all day long if you want to. There's nothing wrong with you eating good fats all day long if you want to. The same thing will be for the non-starchy vegetables. You can have that all day long as much as you want to, because they don't, first of all, they are not really, they don't have carbohydrates, most of them, and the non-starchy vegetables have more healthier carbohydrates. So you want to be making sure that your fruits, your cereals, your grains, your sweets, your dairy, especially the milk, mostly milk, are consumed in a portion size,
Okay.
small portions. And normally what I do in my practice, for instance, is if I draw a circle simplifying a plate, a quarter of that area, I make them sort of think that there's 30 grams of carbohydrates for breakfast and 30 grams for lunch. And the rest you can actually fill up with everything that I said that will not raise your blood sugars, your good fats, your lean proteins, and non-starchy vegetables. And so you are confining your carbs during the times that you're more active, okay? And you are feeding yourself all day long, meeting your calorie requirements with food that will not cause you to gain weight, versus eating fruits for breakfast, fruit for a snack, fruit at bedtime, whatever. I mean, fruits are great, and we were talking before the show started that fructose is not really an easy carbohydrate to digest. Fructose, in essence, actually has a lot of bad byproducts like uric acid. It can be converted into uric acid. It can actually promote the production of fat through chemical processes in your body. Okay, this is if you eat in excess. I mean, an apple is not going to do that. But if you think that, for instance, a fruit salad, and you eat a huge bowl of fruit salad with the syrup and everything there that you bought in a can, first of all, that's not natural. So all that stuff is going to cause problems. Some people think that eating, the fruit in a can is healthy as compared to eating the real fruit.
Right.
So you have to be careful as to your choices. I'm not going to tell my patients not to have their pears that come in a can, as long as they probably have maybe a couple slices, and that's it. If they want to count really the carbs, rather than eating the whole can or 2 cans for that matter.
You mentioned earlier about true carbohydrates. Can you explain that real quick? That's my last question, I promise.
Sure. No, that's fine. So for us, at least for our view in the clinic, the true carbohydrates will be the ones that actually will spike your blood sugars very easily. Okay, that will be all your starches, okay, your cereals, your grains, rice, beans, stuff like that, fruits, okay. Especially
one question. So you say grains and rice, which I love. Are there particular grains that are not as harmful? Like white bread, I don't do. But what about the multi-grain breads? Does it have the same effect?
No, because if you have fiber, that's the key part of it. Because you want to add fiber to your meals. Fiber actually reduces the absorption of carbohydrates. So fiber, the more complex your carbohydrate is, the better it's going to be for you as well. So quality plays a role, and it's very important as well.
Okay. What about rice? So white rice, I don't really eat a lot of that very often, but are there different types?
But it's okay. It's okay if you eat in a portion, which is more or less about 1/3, and that could have anywhere between 22 grams to maybe 25 grams of carbohydrates. That's fine. But see, when have you ever really sat down with someone who eats rice and eats 1/3 of a cup? I mean, that's almost unknown.
Right.
I'm Peruvian, and trust me, we don't need 1/3 of a cup. We don't. And I'm a physician, and I sit down with my family, and I need just like anybody else, and I do not eat 1/3 of a cup. The thing is that how you eating it, and of course how often or how much you eat it. I mean, if I tell you, yes, my main diet, just like many Mexicans, they eat a lot of tortillas. We Peruvians eat a lot of potatoes and rice. But I'm very careful as to what I combine in my meals for the most part. If I want to do that, I mean, if I have especially a condition that is already in my body, I'm not going to be eating potatoes plus rice plus corn plus a roll of bread. I mean, you have a whole lot of carbs, and then you have your steak or whatever meat you want, and whatever, if you have soup or you have water or juice or wine. I mean, you have to think about what you're consuming.
Yes.
Because unfortunately, a lot of us are gluttons. A lot of us don't think about the portions. don't think about what we put in our mouth until it's too late.
Right.
You know, just like I'm a human being, just like anybody else, I'm overweight. You know, but I try to maintain a steady state in my body by making sure that I'm not overdoing things every time.
Yes.
Because frequency is what's going to lead to the problem.
Yes.
I mean, if people cheat a couple times a week because that's what they want to do, but they're really taking good care of themselves for the rest of the week, it's fine.
Yeah, yeah, yeah.
But if you do it every day, no, that's not going to be good.
So I love to close on that topic. So because what I heard you say was gluttony. It's such a strange word, but it's so relevant. As a society, we tend to want more, 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 and unfortunately, it's evident in not only our lifestyles but also in our health. Right? Can't hide the health thing. So what we kind of talked about before is about moderation. If I'm pre-diabetic or type 2, and I feel devastated, no, my life hasn't ended, but changes, I have to modify some things. There might be some fear in that because I've been doing this, like my body has actually sustained me for this amount of time, but now all of a sudden it's screaming at me. It's telling me, well, the results are telling me it may not be manifesting in a way that I can actually feel it, which is one thing too. When we don't feel diabetes, we don't tend to think we're in peril, right?
Exactly.
So we're not going to changes as quickly until things start falling apart, right? But what I want to encourage people, because the whole premise of us doing this is to take responsibility for your health. Now that means to push through the fear and realize that it's a lifestyle, right? What works for me may not work for you, but what does work for everyone is consistency. So you find what works, that something that you can handle. I like what Martin said is, you might cheat, but don't give up. It's okay to have something that you like once in a while. Like I'm trying to think of something that I'm like, I love chocolate. I eat chocolate every single day, but I don't do milk chocolate. I've learned the health benefits of dark chocolate.
Exactly.
So I eat dark chocolate every day, so I can still get that thrill.
Exactly.
Dark chocolate, but so I just modified it a little bit. So I just want to encourage you, if you're struggling with it, or if you know a loved one that is, edify them and encourage them to make little changes. Dr. Ruiz can go on and on and on and on about the dietary, the diet itself, and the good carbohydrates and the true carbohydrates, and help you develop a plan, and he's going to give some information on how to contact him, so that if you want to get some more details, you can contact him directly. But what we both understand is that, take that step, don't be dependent on what may be down the road. Take responsibility now, because our ultimate goal is to live as long as we can, as healthy as we can, so we can enjoy our lives. So that's what I'm here for. And if you want to go ahead and close with some wonderful remarks, if you have any good last minute advice.
Well, I don't know if I can make it as wonderful as yours. Yours were very good. I mean, but yes, I mean, don't give up. I think everything is based on choices. All of us are human beings. All of us deserve to enjoy our meals, but you have to understand that as we get older as well, moderation has to be the rule. I mean, you have to think about what you're investing now and what you're going to collect later, because trust me, I've been doing this for so long, and it's sad to see our elderly patients right now to be investing so much money on a disease that could have been preventable. And they could have actually enjoyed their retirement much better. They could have gone to trips. They wouldn't spend more money maybe in their grandkids. They could have bought maybe a better car, a better house. They could have done a lot of things rather than paying thousands of dollars. And this is not kidding. Thousands of dollars are being invested by every single individual in the care for diabetes. And this is terrible, because when you're supposed to be enjoying your older years, basically you having a miserable life, spending money and making the pharma companies more wealthy than they already are.
Yes.
You know, and it's sad to see that in our elderly patients nowadays. And of course, the young ones are going to go into that sort of process. And the downside for that is that the younger you become sick with diabetes, the more money you're going to be spending in the system. The more money the less money you're going to have in the future. You know, and of course, the more complications you can have at the end, and a really terrible life towards the latter part of your day, which is bad. I mean, you don't want to be confined to your house because you don't have any money to travel. You don't want to be confined in your bed because you had a stroke or a heart attack or have congestive heart failure. You don't want to be confined in your bed because someone amputated your leg or your entire leg or your toes, and now you cannot walk and you have to be confined in a wheelchair. I mean, it's just horrible. Yes. In 21 years of doing this, I've seen so many patients that have had a terrible life because diabetes is not good. It's not good at all. Yes.
Okay. And that's where we don't want to go. So that's why we're here, to give some information. So take responsibility today, right?
Exactly.
So,
exactly.
How can people contact you?
Sure. Yes, they can email me if they want to. Of course, my email is M as in Mary Ruiz. My last name Ruiz as in zebra, MD. Okay, at me.com. So M Ruiz MD at me.com. And they can actually send me their questions. I can actually send them the meal plans that we do in our clinic. You know, give them some tips about this stuff. Diabetes can be reversed. Don't make it worse for yourself. Take your initiative to change your lifestyle. If you don't have diabetes and you have been diagnosed with pre-diabetes, please really work hard at it. You don't want to have diabetes. I mean, diabetes is going to ruin your life. So you don't want to have diabetes at all.
No, we don't. We don't. Well, thank you so much. You gave a whole lot of just amazing information. I am a lot smarter now. And thank you guys for joining us today. I would love to have you back in the future to expound.
Thank you so much. I would, of course.
Thank you, everybody, for showing up, and like and share. And we will see you next Wednesday. We'll have another doctor on next Wednesday. We'll be talking about gut health. And I appreciate you so much, Martin.
No, you're very welcome, Rachel. Thank you so much for having me here. Appreciate it. Appreciate it. Thank you so much.
Good night.
Take care.
Thank you.
Good night. Bye-bye.